Hey everybody, welcome. We're here again with you, Leslyn Keith, the Lipedema Project, and my friend and colleague, Siobhan Huggins, here with you again, as we usually are on Fridays, just to recap the week and let you know what's coming up, because there is an awful lot happening to do with lipedema coming that we just had happen and coming up. It's all pretty exciting, so we're going to be talking about that with you, but Siobhan and I always love to know who's out there, who's listening in while we're live. And so if you want to just put in where you are in the world, maybe what the weather like is doing there. If you have any, as we're talking, as Siobhan and I are just chatting, be sure and make comments on what we're talking about. Or if you have a question or a comment on something else that has to do with lipedema, please post that. We love to interact with whoever's here. I think it makes it interesting for whoever is watching the replay too. So, and I know that one thing Siobhan definitely wants to get to right now is recapping our wonderful 3-day virtual heart-to-heart event that we just had last weekend.
Yay.
Pretty exciting. Siobhan, well, let's just talk about, what happened at the event and then what our highlights were. Go ahead.
Yeah, so it was a 3-day event, and I'm not very good at timelines, but The first day I do know for a fact that both you and I spoke, kind of giving an introduction and tone setting, and Lisa and Catherine also talked about the Lipedema Project and Lipedema Simplified and their roles in the whole event and the stuff that we've been doing in the community, which has been great. And then some highlights from, wasn't Gabrielle on day one? Am I misremembering?
I think you're right. I think she was. I think she was on day one. Yes.
Because so Gabrielle, I'm referring to
Dr. Gabrielle Farber is so busy presenting at events, going to clinics and talking to them. I mean, she is really out there spreading the word. And so she was doing something else. She was talking at a clinic on Saturday. So she asked to be with us on Friday, and she was even there at the end of the day Q&A, which was midnight for her in Germany. So, but talk about her presentation, Siobhan.
Yeah, so she was talking about the new guidelines for lipedema coming out of Germany, and she helped clarify some things, because I have seen some people talking about, well, the German guidelines say compression isn't necessary, and from what she spoke about, that's actually not true. So that is helpful information for people. She talked a lot about the specific language within the guidelines in terms of can recommend, may recommend, will recommend. There's a lot of importance packed into those 3 different words, which I found really interesting.
Yes.
And there were nutrition recommendations in there, including talking about Mediterranean diets and then also ketogenic diets as 2 different options. I always like to see options within guidelines, just personally, because one size is not going to fit everybody. So here's some things that may help in general, and you can pick and choose. So that was really good. And then we also had Peter Ballerstedt on day one. So he talked a lot about how improving our own health is improving the world, and about protein quality, the differences between protein from plant source foods versus animal source foods, the importance of ruminants for overall health, including addressing both malnutrition and metabolic health as well, and how those 2 might have some overlap in terms of what we're seeing. So that was all just in day one.
I know it was packed. It was packed. And so were the other days too. I mean, it was, and this is with Siobhan and I were really trying to shorten the days a little bit, not have them quite so long, and be able to make sure there was lots of time for people, attendees, to interact with each other and process what they're learning. Even with that, I mean, most people I've talked to were pretty exhausted after the three days. Even though we were trying to make the days not quite so long, it's still it's a lot. It's a lot that we do, that we pack into 3 days. Those people that had premium access, they are getting recordings. So if they had to take a break and were able to listen, or if they just needed more processing time and wanted to re-listen to something, rewatch your presentation, they have access to that. And so, and I do believe you could still purchase access to that even now after the event. So if you were sorry you missed it, I think you could still get access to those replays.
Yeah. And Christine Halverson said, my brain and heart are still recovering in a good way.
In a good way, yes.
Yeah.
You are absolutely right, Christine. And so glad that you were there. Thanks for being there and making that comment.
Yeah.
Day two
had a lot of impact with people.
Can you remember what happened on day 2?
Yeah. So on day 2, we also had Jen Unwin. She was talking about carbohydrate addiction, which I found really interesting because she was talking about the overlap in terms of brain scans with other addiction disorders like alcoholism, for example. You can't necessarily tell the difference between carbohydrate addiction and alcohol addiction, things like that. And I've seen some experience of people who, even on a ketogenic diet, they were having persistent carb cravings and obsessive thoughts about food. And when they went to a therapeutic ketogenic diet, so they increased the fat, suddenly all of that quieted. And to me, it was like, oh, well, if you're treating a psychiatric condition, then some people may need that prescription level keto to address that. So it was like, oh, that's so interesting. That's so fascinating. And then we also had Georgia Eade, who paired quite nicely. She was talking about the links between metabolic health and nutrition and mental health. So she has a new book out called Change Your Diet, Change Your Mind. And Leslyn has it right next to her. But that book came out, and I'm going to start just recommending it all the time. So we read it for our book club as well. And it covers so much valuable information that's not just relevant to mental health concerns and metabolic psychiatry, but also it covers a lot about what we talk about with lipedema and food sensitivities. So she explains why people might be having issues with dairy, why people might be having issues with nuts or grains or all these different things. And she has recommendations for quieter foods that might be more tolerable. And she also has 3 different plans for how to eat for mental health. But I would also suggest for health in general, if you have health conditions that may make you more sensitive. So she talked
I want to say one thing about Georgia's talk, which I thought was fabulous, that she said, you know, studies have shown that the head is connected to the body. And this is important because people are thinking, oh, great, I'm going to eat this certain way that is going to be great for my brain and my mental health. But isn't it going to be bad for my heart or other conditions that I have? And she said that what's good for your brain is actually going to be good for the rest of your body because they're connected. So I think it is, I think we're unduly worried about that we have to eat a certain way for each condition that we have.
Yeah, there may be some exceptions. Like I know central lymphatic disorders can be a little bit different because of the fat processing aspect.
Yes, but what you do for central lymphatic is going to be good also for your mental health. It's because it's all connected.
True, yeah.
So whatever way that you find that works good for you, it's going to be good for all of you.
Yeah. And the reason that we had wanted to pull Georgia in is that we know personally in some cases and just in general that the psychological toll of having a chronic disorder that you have to navigate every day, that especially when it's disfiguring, it can be upsetting. And one thing that I really like about Georgia is that she talks about how when you nourish your brain, it's not just addressing frank conditions like depression or anxiety. It can also offer some additional mental resilience. So the daily stressors of life become that much easier to handle. And there were tears after Georgia's talk by many people, some of us, some of the audience, everybody, because there was so much hope in her talk. And there were so many people who were becoming interested in metabolic psychiatry after that talk, which was really, really great to see.
And there is at least anecdotal reports. This hasn't really been studied as much as we would like, but there is talk about when you have a lot of stressors in your life, either mental or physical, and you don't have good stress resilience, it might actually be implicated in triggering or exacerbating lipedema symptoms. And so the better that we manage our mental health and improve our stress resilience, the better it's going to be for all aspects of our lipedema.
Yeah. And slightly divergent, but actually ended up fitting really nicely, was we had Brian Wiley. He works with Dr. Tro. He does coaching, and he's done a lot of great material on how to do low carb on a budget. Or you could think about it, how to eat healthy on a budget, because maybe you're not low carb, but a lot of the stuff he was talking about can be used for anything. And so he talked about manager specials and apps that you can use and coupons and just like little nifty tricks about holidays and when things go on sale. There was so much information in his talk that it was spilling out into the chat because there was so much discussion from people being like, oh yeah, I do this, I use this app, that app doesn't work here, you have to use this one. And it was so great to just see people being excited about it and like, oh wow, this is great.
And seeing that it's actually doable. I mean, because there's a lot of people that are out there on fixed incomes and just feel like, if I have to spend one more dime, I don't think I can do this. It gets very overwhelming. And he made it seem very, very doable. I had a discussion with him prior to the event about, you have so much information about how to do this on a budget. And you don't even say anything because, there's not time, but you don't even say anything about how much money you save on your healthcare, on copays, on deductibles, because you're not having to go to the doctor as much because you're lowering your dosage and not getting as much medication or even getting off some medications. There's a ton of money you're saving right there. But then also just to look at just your grocery bill, and being able to manage that one bill better is so helpful to a lot of people.
And what's funny about that is I had actually seen a post from someone on the ketogenic forums back in the day where they actually was like, okay, I'm no longer diabetic. And they started running these calculations of how much money they had saved in terms of healthcare cost alone. And it was to the tune of $10,000 a year. From no longer being on medication, no longer having to go into the clinic as often, no longer needing as many checkups, less sick days, like all of this stuff. And so it can be a bit of almost like getting a pay raise just for.
Yeah, you can you can buy a new car. That is amazing. I had not seen that figure before. That's absolutely amazing. And so then what did we do else did we do on day 2? It was a lot.
Did something new. Yeah, we did something new. So we did laser coaching. We had some people who were interested in going through the process. And to be honest, I was a little bit nervous because I was like, what if they come up and we just don't know? Like we just have to shrug and be like, I don't know. But it was actually really great. We had some really, really good discussions that not only applied to them, but applied to people in the comments too about navigating food, about navigating body image and rebuilding that relationship with your body. There was a lot of really good stuff that came out of that laser coaching, and I'm really glad that we did it. And I actually thought it was really fun to just have people come up and just give them that one-on-one time or 3-on-1 time in some cases, and just kind of walk it through, because there's so much stuff where in your own head, it's all jumbled up and knotted. And if you can just get it out to people and walk through it with them, you can have maybe 1 or 2 things that's like, oh, I can do that right now. So that was really fun.
Yeah. And it was meant to help that one person who was getting the focus of all of the coaching, but it was meant to actually be educational and helpful to everybody who was watching us do that. And we also had a patient panel, people who have lipedema, and they were sharing their experiences with it. One had just had surgery for lipedema. They all did individual adjustments to their diet and did other ways of handling it. And they're all talking about the the importance of community and to support them as they go on this journey. It's never ending. We're always making adjustments and learning new things and trying new things and helping others and stuff. So that was a great discussion with 4 different people that have lipedema. That was a nice discussion. I see one of them is here in the chat. Anne Marie is joining us, listening to us right now. She was on the patient panel. And of course, we have our own Gail Straker, who was on the patient panel, who's kind of behind the scenes working all the tech for us right now. That's 2 of the people that were here on the panel. Was there more? I mean, I know there was networking times. There was
a whole bunch.
Yes.
If we went into it, it would probably take a whole other weekend. It would take us from this Friday to Monday. But we did have a 3rd day. So we had some discussion about tribe and just kind of navigating all of these decisions that we have to make. One of them was with Dr. Carmody, where we talked about GLP-1 medications. So like Wegovy or
weight loss drugs. Yes.
And there's a lot of interest in these for lipedema for obvious reasons, because many people have struggled and they want to get the functional fat off if they can. And so this is one avenue people are exploring. And so Matt was talking about kind of what they are and how they work and some potential side effects. And then we had a discussion panel afterwards. I came up and we started talking about what are some concerns that people might have? What are maybe some things you want to look out for if this is something you're interested in? Is there considerations for how long they work? Because some indications are after 1 to 2 years. For some people, some of the effects may wear off. So how do you fit that into your long-term plan? So we ended up having a really good discussion on it, both from a very optimistic side and then from a more cautious side, and figuring out where we can meet in the middle somewhere to make sure that people, if they do decide that these are right for them, that they can do so in an informed way, and they have some questions that they can take to their own healthcare providers and say, can you help me keep an eye on this? Because I think this is right for me, but I want to do it in a way that's going to be safe and just shoring up as many resources as I can.
Yes. And then for the people that decided to join Tribe, we had a little celebration for people to get together. And that reminds me, we should maybe let people know that for a short time, Tribe membership is open. We only open it a couple times a year. So there's just a few opportunities for you to be able to join. And this is one of those times. It is, well, it's a support community. It's a learning community. I think we say learn, connect, belong. That is a place to do all those things. And so there is more information if you look at the link below. What has Tribe been for you, Siobhan?
I mean, just real quick, I don't want to leave Sherry Honeycutt out because I know she helped a lot of people at the end of the event. So she was talking about designing your life on purpose, which will actually dovetail nicely into this. So one thing that I found really cool was at the end, before we went into breakout, she asked, like, let everything that happened during this weekend just kind of float in a pool around you and pick out 3 things. And whatever those things are, those are things that you can work on, kind of thing. So kind of helping people prioritize. And I'm sure for some people that was Tribe, because at least for me, it's been a place where I can talk privately about lipedema. I do have a larger life with the low carb community, and I don't always want to talk about lipedema with them. I do sometimes, but there are other times where it's just like, I don't want to have to explain anything. I don't want to have to answer questions. I just want to be able to put something and other people say, oh yeah, me too. I get it. Or get advice for things. I've gotten advice on compression. I've gotten advice on pool time and prioritizing fasting if it's helpful for me. It's given me the opportunity to participate in the CSIGs as well. Sometimes I'm one of the coaches on there in a more teaching role, but others I've participated as a student, and I've ended up learning a lot and had a really great support. And the other cool thing is it helps me socialize because I like to hole up in my little cave and not, I mean, I go outside, I just don't talk to people.
Yeah.
But so we also have the artsy fartsy craft and chat, or the inspiration corner, whatever you want to call it, which is coming up this Sunday for anybody who's in tribe. But that's where we can all get together and talk about stuff we like creating, which,
Yes.
like, sometimes with lipedema, I feel like we can get really wrapped up in our own self-care that we forget another important aspect of self-care is tapping into creativeness and relaxing and just having fun with our lives. Like, our whole life is not lipedema, even though it can seem like that. So having a place where we can all get together and talk about things that we're knitting or crocheting, or people have talked about paper crafts or things that they make from stuff that they get from the dollar store, and they paint and do like all this cool stuff with it and create little mini scenes and Zentangle and just all sorts of different stuff and it's so fun to see what other people in the community are creating, and just have some place where we can hang out and we know what we're going through and what we're struggling with, but not focusing on that for a couple of hours. So for me, it's been really helpful, not only for education, but for social connection and support and understanding, and just feeling like I'm not alone in the world with all the difficulties of feeling like I have this weird problem, and then I can mention it and people are like, yeah, same, is sometimes all you really need to hear.
Yep. It just not having to always explain yourself. People automatically understand, they know where you're coming from, and you can just go on from there. That is a wonderful thing about tribe, and something that people mention a lot. So if you want to learn more about that, again, it's just a short time that membership opportunity is going to be open. So be sure and click below and see if that is something for you. So it was a action-packed weekend. We did spend I think it was maybe 10 hours a day with our meetings ahead of time and our special premium Q&A after the day closed. It was probably about 10 hours a day that we were there doing stuff with the event, and it took a good 2 days afterwards of getting at least 8 hours of sleep and to recover from it. And now we're ready for the next thing.
Not
sure what that is, but
next things.
The next things. Thank you, Gail, who has put this up for us to remind us that we need to talk about. We're so excited that our paper came out, proposed framework for research case definitions of lipedema, and in the stated purpose of this paper was to strengthen research, because everybody will be working from the same definition of lipedema, and now we can pool all this data together. But we found other exciting reasons to purposes of this paper that I think is going to really affect the lives of patients with lipedema. Siobhan, you want to talk about how we think that you, as an individual patient, how can you use this paper?
So one of the things is it's an accumulation of a lot of the research behind lipedema that we felt had the strongest quality evidence. So it talks about the edema component, it talks about the pain component. But what's cool is that even though it is for research purposes, so the difference between a case definition for research purposes and a diagnostic criteria, for example, is that the research one tends to be a lot more strict. But the descriptions that we have in the paper, someone could take this paper to their doctor and say, hey, could you read through these descriptions and go through it with me and either diagnose if you're comfortable, which some primary care providers are, or could you use this as a basis to give me a referral to a specialist so that I can get a diagnosis? So one issue that we're running into is that a lot of doctors don't know what lipedema is, or what it looks like, or what the symptoms are, or how to even tell if it's not something else. So this paper, the information in this paper, could be really helpful in that regard, to just give them a quick rundown with really good descriptions of where to palpate and what it should feel like and how to grade it and what cuffing looks like and how to grade it and all of that. And doctors can go through this with their patients and say, yeah, it seems like you fit this. I feel comfortable enough. Let's go ahead and get you a diagnosis. Or if they're not, I'm going to go ahead and refer you to someone who can, because you need a diagnosis, sometimes for proper care, for insurance purposes, for peace of mind that this is actually what you're dealing with.
Mm-hmm.
So I think that component is really important. I've had people ask me before, like, can doctors use this for a diagnosis? I think that's up to the individual doctor with their own comfort level. But it is something that can be used as an educational piece and as a practical piece to get clinicians a little bit more comfortable with lipedema and what it looks like.
Because some we talk to people who say that my doctor doesn't even believe that lipedema is a thing. And so being able to take them a paper that's been published in a peer-reviewed journal, it's open access, so everybody can get it. Everybody can see that, and there's pictures in it, there's charts and diagrams and stuff. And so now you can give this to maybe that physician who didn't even think that this was a diagnosis. And then, so it's going to increase their awareness, and maybe they'll notice it in other patients that they have as well. But maybe then it could be a step towards you getting a diagnosis. There have been, I've seen it in the literature, that people have waited 25, 30, 35 years to get a diagnosis. They've known something is wrong for, quite some time, for decades, but they got to wait that long for a diagnosis. That's not right. How can you access the proper care and treatment and support if you don't even know what you have, if you don't know what the diagnosis is? And so let's help people raise awareness and get that diagnosis earlier and get treatment earlier. So this is what we feel like this paper is going to really help people with.
Yeah, and one other aspect of this is that we call it a framework. So I always feel it relevant to mention, like, this is a living thing. So we're hoping that other researchers and other clinicians and other patients will read through it and say, hey, I have an issue with this part, or I think you should test this part. Here's how we can do it. And, or maybe they have their own research that they've done that contradicts something we said. We think that's great. We want to hear about it. We want feedback on it. We want all the criticism, everything you got, because over time it can be updated. It can be put back out as a fresh version. The more we learn, and the stronger it becomes when we do that. So the more people it can be read by, the more feedback we can get, and the better it can become in the future, if I could speak.
Yes.
So yes.
Yeah, it's like you say, a growing document, a living document. This is meant to be updated. We are not saying this is the end of it. We know what it is, and this is absolutely it. No, this is something that we want everybody to contribute to and update it as needed. And this is really important. What Wendy says, she wants to get this paper to her doctor. How do I do this? Wendy, I want you to, we do have the link to this paper posted. So you should see that. Perhaps if you're on your phone, though, it might be more difficult for you to see what other people are posting, but we have posted this link down below.
I'll read out the title for you, and
yes.
You should just be able to look up this title and it'll pull it up. And then the PDF is accessible, or you could just send a link to the page because it is open access.
Yes.
So the title is Proposed Framework for Research Case Definitions of Lipedema. And the first author on that is actually Leslyn. And then the senior author is Stanley Roxon. So if you find that one, first author Leslyn, senior author Stan, and then that title, or you could email Leslyn for a link if you have any trouble finding it. It's leslyn@lipedemaproject.org. Just reach out through there, and then she can send you a link to it, and you can just forward that email over to your doctor.
Yes.
And then you'll be all set.
Yeah, feel free to email me with if you want links to this article, or you want me just to send you a copy of it. Even though you can download it from the website, if you do get to that webpage for the article, you can download it, but I'd be happy to send it to you as well. But any other questions to do with lipedema, send it, email me. I would be happy to talk to you. And You've done it again. You spent another 30 minutes with us. Did not that go by fast? And we've talked about so much today. I wanted to also be able to respond to any questions that you guys had. And we saw Wendy's about how to access the paper. I didn't see anything else except for people saying hi, and thank you for doing that. Mary Jane from the Northwest of Indiana, and Sing It is in Chicago. It's 56 degrees. Julie Rosa, my neighbor in Camarillo, and it's about 65. Yep, that's what I got too, Julie. And here's a good question. We'll do this really quick, and then we're going to close down for today. But Sing It wants to know, is lipedema swelling mucus? Is that why Mucinex supposedly works? Siobhan, you want to take that?
So I had looked into this a little while ago because I had seen Mucinex or guaifenesin recommended to help reduce the swelling and things like that. And I'm not sure I fully understand based on the mechanisms of Mucinex, which essentially increases the fluid that's in the mucus, like in your lungs when you're sick. But how that would relate to lipedema. However, I have seen in the community that some people have found that it's helped reduce some of the swelling and things like that. So there might be a mechanism that we're just not aware of, or maybe it is related to how it impacts mucus. My understanding of the lipedema fluid is that it's fluid within the tissue that's bound up into like this gel-like substance. So that causes that spongy feeling. And then if you have lymphedema, it's essentially also free fluid as well, which is why you can poke into it and it leaves a dent. So I don't think that qualifies as mucus. Maybe I'm wrong. But given that some people have said that Mucinex can help, there's something going on. But one thing with medication, even over-the-counter medication, is that it usually does like 20, 30, 40 different things, and we focus on one of them. So there's always a chance it's doing something we don't realize. But one thing
we don't like, yes.
Yes, including that. So one thing is there are other people who've had bad experiences with it, or it didn't do anything. So with any supplement or anything like that, I always recommend checking in with your doctor first. Let them know if you're planning on experimenting for it, especially for off-label reasons. And then make sure that you have someone you can check in with periodically throughout to make sure if you do have any weird side effects, that person is going to be on the lookout and can say, hey, let's actually pause this. It seems like you're getting some negative effects and we don't want that to continue.
Yeah. And there, you could have actually interactions with other medications you're taking. All kinds of stuff can happen. But what an interesting thing that I've been looking at with some other colleagues, including Kelly Bell, is the coagulation of lymph, the thickening of lymph that makes it drain slower. And Mucinex is an anticoagulant, and things that are an anticoagulant, meaning it. An easy way to put it is it thins the fluid. It works on your blood, but it also can work on your lymph. And so that might be the mechanism of Mucinex and why it helps some people with lipedema and lymphedema. I don't know. It's a hypothesis. So
yeah, that's interesting.
Yeah, and it's but I think it's really important what Siobhan said. Even though something is over the counter, doesn't mean you should just take it willy-nilly without talking to your healthcare provider, because you've got other medical conditions, probably you have other medications you're taking, and even though it's over the counter, it can have side effects. So make sure that you talk to someone and discuss this before taking even over the counter medication. So that is all the time we have for today. Gosh, it's been a great discussion. Thanks for being here and being here with Siobhan and I. We enjoy getting together with you every Friday, and we will see you again next Friday.
Yeah, see you.